the hip flexors. Here's our guy again. Now what we're going to do, we're going to straighten him up because he's a little broke. But anyhow, here's your medial aspect of the hip. Okay, here's your hip flexor. We already talked about the rectus femoris, and then we have the iliopsoas. Now, the other component of the skeleton's over here to my left, but I want you to visualize. Here's your spine. The psoas major comes off the off the spine itself and blends in to the iliacus, which attaches to the inside of the pelvis. Hence the name, iliacus, ilium. And it blends into a common tendon that comes down and attaches to the lesser trochanter of the femur, which is right, you can't even see it, it's right back here. So you can imagine that muscle comes down and it gives a twist into and behind the femur, so it becomes a very powerful external rotator. Okay, the joint mechanics on this is not very good, but it's an external rotator. It turns the femur outward. It's obviously a hip flexor concentrically. It's also an AD, I believe it's an adductor. Okay, there's some books out there that say it's an abductor, but I don't believe it is. You look at the muscle, and if we shorten the fibers, it's going to bring the femur closer to the attachment sites of the pelvis and the lumbar spine. Eccentrically, more important, that's what we're talking about, is it decelerates in the central plane extension, decelerates internal rotation, we're talking about the iliopsoas, and it decelerates abduction. You see, if I'm attached here, and here's the attachment site right down here, and if I go into abduction, I lengthen that muscle. So it decelerates in abduction, especially abduction, internal rotation, and extension. That's your big component of deceleration. Iliopsoas decelerates extension, internal rotation, and abduction. The other hip flexor, the TFL, major muscle. Probably the one that gives us most trouble. The iliopsoas gets blamed for being so tight. Oftentimes it's the TFL that's the tight, overactive muscle. Again, that gets into the MTS level number 2. We talk more about that. Anyway, it comes off the ilium and attaches fascially to the outside of the hip, runs down through the IT band, and again attaches to the tibia, lateral tibia, and the lateral patella. And it's a hip flexor concentrically. It's an abductor concentrically, and it's a internal rotator concentrically. So eccentrically, it decelerates hip extension. Our hip is falling apart. Decelerates hip extension, decelerates adduction, and external rotation. So a common thing to stretch, it's a very tough muscle to stretch. We can do plane by plane. We can externally rotate in the Faber stretch. I'll stretch that TFL. We can stretch it into obviously extension, or we can actually, it's a little bit harder to do the frontal plane is we go adduction. It's a very tough muscle to stretch. Oftentimes we can get at it doing foam roller and things like that. Here's just a little tangent. It's often a compensator for the posterior medius. This muscle will become the primary abductor and compensate for the posterior medius. That's why we want to stretch it out, and we want to do things like clamshells and bridges and things that externally rotate our hip. So the hip flexor group, there's other sartorius. It's a hip flexor coming down through. You can look in the pictures and see their attachments, but similar, same old song and dance. But the hip flexor group right in front, and that's why we want to stretch them. We want to train them eccentrically. We want to make sure there's balance between the two. The hip flexors will become over dominant because people sit all day or what have you, and the glutes will shut down. So we want to balance those muscles out through functional flexibility, functional mobility, and functional strength. The hip flexors.